Good afternoon. I'm Bob Watkins, and my topic is two-level neck fusion in athletes. What are our concerns about return to play after two-level fusion? Number one, difficulty in returning to elite status. This is a different mechanical situation. Future degeneration, adjacent level disease in a 20, 30-year-olds of significant concern. Catastrophic risk of fracture and spinal cord injury and paralysis with return to play is obviously the main concern. What about return to play after two-level fusion in the literature? It's limited data. One successful return, one unsuccessful return, and one catastrophic report. Those are all significant. Helmets cause a decrease in brain injuries, but an increase in cervical fracture dislocation due to spearing or head-first contact. Torg determined that most cases of permanent quadriplegia were due to head-down contact or direct axial loading to the cervical spine. Under direct axial loading, the neck typically fails in flexion, but may actually just buckle in the middle, like pushing on the ends of a soda straw. Kyphotic segment, spiritacular spine increases the risk of a flexion injury. During a head-down tackle, the compressive impact may be up to 98 times the force of gravity delivered axially to the cervical spine. A stiff neck may make it more difficult to even look up. Heads up, see what you hit type tackle and proper technique and predispose one to a flexion injury and increased stress and C3-4 flexure dislocation, for example. I turned this problem over to my medical illustrator, Christopher Watkins, and he came up with three illustrative pictures. Number one, the picture at the left is a routine head contact in which the cervical spine straightens out to deliver a blow or receive a blow with the crown of the helmet. Number two is a typical postoperative fusion picture, demonstrating a lordotic segment, as it should be, through the fused level. Number three is an axial load directly to the head on a straightened out cervical spine, except that the lordotic segment can't straighten out and produces a flexion riser, stress riser, and a fracture dislocation at the level above the fusion. That's what we're all worried about. So if that's a problem, what are the alternatives to a two-level fusion? Well, it depends on the pathology and the sport and the individual player. For single-level pathology and with healthy adjacent levels, disc herniation or neurological deficit, ACDF is the best way of protecting the spinal cord, the neurological elements, and return to play. In our practice, we've had 25 professional athletes, most of which were NFL with single-level fusions, 80% return to play, average 9.5 months. So these are all with solid fusions, and an 8% subsequent adjacent level surgery. Results of foraminotomy versus fusion. Foraminotomies heal fast and have a high return to play, but more problems subsequently at the index level. Therefore, we prefer a fusion for single-level symptomatic nerve pathology. Multi-level pathology with one symptomatic disc and other levels that don't have a significant risk of catastrophic failure. We do a single-level ACDF. This is an example of an NFL player that had a herniated C5-6 disc with C6 radiculopathy. We fused that despite bulging at the level below. He subsequently developed some symptoms of neck pain, but no catastrophic subsequent problems. If you do a case like this, you obviously have to have some backup plans if the adjacent level becomes symptomatic. Artificial disc and retirement was a reasonable backup plan in this player. How about multi-level, one symptomatic and a second level with high risk post-fusion potential problems? A lot depends on age, sport, position, degree of symptoms in normal life, not playing, etc. No surgery and retirement, foraminotomy, fusion, artificial disc are all potentials for this, with or without retirement from the sport. What about multi-level problems with two symptomatic levels? That's the most difficult scenario. Posterior foraminotomy is certainly possible, but you need signs of nerve root compression in order for that to be successful. We've had players return to hockey and all-pro football safety, and multi-level foraminotomy was the treatment. How about contact sports, baseball, basketball, foraminotomy, ACDF, and two-level ACDF, probable return to play. Collision sport, return to play, foraminotomy, probable, ACDF, probable, ACDF two-level, not likely to return to play. Every return to play requires a proper rehabilitation program, and hopefully our family will be back at Dodger Stadium next year. Thank you very much.